How does trauma cause intrusive thoughts and PTSD? Imagine your mind as a busy library where memories are stored like books. After a traumatic event, some of these books become disorganized or misplaced, making it hard for the brain to file them properly. This disorganization can cause distressing, unwanted memories to pop up unexpectedly, which are known as intrusive thoughts. These thoughts are a core symptom of post-traumatic stress disorder and can feel like the traumatic event is happening all over again. Trauma involves exposure to situations where there is actual or threatened death, serious injury, or sexual violence. When someone experiences such an event, their brain's normal way of processing memories can get disrupted. Instead of creating a clear, integrated story of what happened, the memory may stay fragmented. It might include vivid sensory details like sounds, sights, or feelings, but lack the context that makes it feel like a past event. This kind of memory processing is called perceptual or data-driven processing, and it makes traumatic memories more likely to intrude into consciousness unexpectedly. These intrusive thoughts often occur when something in the environment or even an internal feeling reminds a person of the trauma. For example, a loud noise might trigger a flashback or distressing image. Interestingly, trying to suppress or avoid these thoughts can make them worse. When someone actively tries not to think about the trauma, it can increase the frequency and intensity of these intrusions. This is because the brain's effort to push away the thoughts can backfire, especially if the person has difficulty with cognitive control or executive functioning. On a neurobiological level, the hippocampus, a brain region involved in memory processing, plays a key role. In people with PTSD, the hippocampus may be smaller or function differently, which hampers its ability to properly link memories with their full context. This can cause traumatic memories to feel stuck and easily triggered. Additionally, other brain areas responsible for inhibiting unwanted thoughts may not work as well, making it harder to control these intrusive memories. Not everyone who experiences trauma develops intrusive thoughts or PTSD. Factors like the intensity of emotional arousal during the trauma, a person's mental health history, and individual differences in mental imagery or memory integration can influence who is more vulnerable. For example, people with vivid mental imagery or difficulty processing memories may be more prone to intrusive thoughts. Effective treatments for PTSD, such as cognitive behavioral therapy, anti-movement desensitization, and reprocessing, focus on helping individuals process and integrate traumatic memories. These therapies aim to reduce the emotional charge of memories and make them less intrusive. Medications may also be used to help balance brain chemistry, but therapy remains the primary approach. Remember, intrusive thoughts are a common part of PTSD but are treatable. If you or someone you know is struggling with these symptoms, reaching out to a mental health professional is an important step. With proper support and treatment, many people find relief and can regain control over their thoughts and feelings. Always seek personalized medical advice from qualified healthcare providers to ensure the best care for individual needs.